All right, looks like we have everyone in, so we will go ahead and get started. Welcome to Advancing Health Center Recruitment and Retention through Health Professions Education and Training. Today we have New Health, which is a health center in Washington State, and they're going to discuss their New Health University and their staff development programs. So I'm going to jump right in. First off, I know we've all been on Zoom probably more than we ever would have wanted or expected over the past couple of years. But just a heads up, we're recording this session so that you can all access it later. And then I'm sure you all know how to use the chat box and everything. If you have questions or comments, please feel free to add those in. And then we're going to pop up an evaluation at the end of the session. Please fill that out. That is really important for us. And we are here on behalf of the Association of Clinicians for the Underserved, which was started about 25 years ago by alumni of the National Health Service Corps. And while we've changed a fair bit over that time, our main focus is still to improve the health of America's underserved populations and support the clinicians serving in those areas. So we provide programs and training and other materials, including support on developing vision services programs and a suicide safer care training program for clinicians and patients. And we provide those for health centers and physicians working in all parts of the country at all different types of healthcare facilities. And then as part of a national cooperative agreement, ACU also runs the STAR Center, which is our Solutions Training and Assistance for Recruitment and Retention program. And that is an NTAP, a National Training and Technical Assistance Partner. And we provide free resources to health centers and PCAs, specifically focused on recruitment and retention so that they can keep their workforces operating and continue to serve the underserved. And here's the STAR Center team. We are all super excited to be with you today. And if you need anything, please feel free to reach out to any of us. And we can all be reached at info@chcworkforce.org. Okay, and then with us today, we have our two special guests from New Health. We have Desiree Sweeney, who is the Chief Executive Officer of New Health. And that is a community health center serving 16,000 patients annually and employing more than 150 staff in Washington State. She's been with New Health for nearly 15 years, leading the organization's mission to promote health and wellness in rural Northeast Washington State. Under Desiree's leadership, New Health has developed a nationally recognized strategic workforce initiative that they call New Health University. This innovative program is the culmination of many years of Desiree developing creative solutions to rural workforce challenges. With us also is Lindsay Ruivivar. She is the Chief Strategy Officer at New Health. She's driving strategic planning and project management, including capital projects. She also oversees the organization's marketing and patient services departments. And Lindsay is currently leading the development of Washington State's first medical assistant pre-apprenticeship. She has nearly 15 years of experience working with community health centers, and I'm really excited to have them both with us today. They have a fantastic presentation for you. All right, but first, real quick, I'm sure many of you who've attended our webinars have used Mentimeter before, but for anyone that hasn't, you can go either on a smartphone, you can pull it up and just read the QR code, and it'll take you to the Mentimeter site. Or you can go to menti.com and enter the code 56181924. And I will go ahead and put that in the chat. Oops. Sorry, it decided it wasn't going to type into the chat anymore. Let's try that again. Oh, looks like most people have already gotten in there, so I'm just going to go ahead and jump to the Mentimeter. If anyone has an issue getting to Menti, please feel free to enter into the chat, and we'll try to get that solved. Okay, and so the question was, would you rather be able to understand anyone or be understood by anyone? And you can only have one or the other. Oh, thank you, Mariah, for putting the info into the chat. Okay, it looks like by a narrow margin, understand anyone has the lead. I keep thinking about this one and I really can't decide. I have no idea. All right. Well, we're going to leave it with understand anyone with a solid lead. And I am going to switch back over.
Well, actually, Alex, we're going to start New Health's presentation, with our first polling question. And this is really to help Desiree and I to get to know you, everyone that is here for this presentation today. So Alex, if you want to go ahead and pop up this next polling question. So it has your health center defined a mission, vision, and goals for your workforce development or health professions education and training program. So you should see 4 options: yes, no, maybe you've done some of it, or unknown. So we see a couple responses across the board. And so we're going to be talking about this through our presentation today. New Health has defined a mission, vision, and goals, and much more. So we'll share those with you today. And I'm going to go ahead and turn the presentation over to Desiree.
Hi, welcome everyone. Thanks, Alex, for the introduction, and Lindsay as well. So we're really excited about our presentation and the challenges we've overcome in some of our workforce development. And so I appreciate your polling, because I remember when we could answer on each one of those as well. So just kind of a reminder, we're in Washington State. And so that little pop-up out of the state, we've been serving that rural community since 1978. And so when we look at the next slide, we really say, well, what does that service area look like when we pull out that pocket? So we serve 3 counties: Ferry on the left, Stevens on.
Desiree, if you can hold on real quick. Hey, Alex, I'm not seeing the ability to switch slides.
Okay, I apologize. You should have it now.
Sorry, Lindsay. Thank you.
Oh, here we go.
So like many of you, we have medical, dental, pharmacy, and behavioral health. And so we're extremely rural. And so now you can see on the map, it looks really flat. We have the 3 locations, and to the left is Ferry, to the middle is Stevens County, and then we have Pend Oreille County on the right. We're bordered by the Canadian border and the Idaho state border. And as Alex mentioned earlier, we serve about 16,000 patients annually. And when we talk about rural, we have about 10.7 people per square mile in one of our counties, and actually meets the frontier. So this is part of the reason we're super excited about our program, because it's very rural, but then when you look at it on a map, it looks flat. But we actually have 3 mountain passes. So those 3 marks that just popped up show extremely some of the travel barriers that our patients and our staff have to overcome to move between those counties. And then to serve more patients, we brought in a mobile clinic. And so now there's more staffing needs that we have. And then we're opening a new site in 2023. And so our workforce challenges actually predated COVID. So probably like many of you, every 3 years, a new clinician would come through National Health Service Corps. We were very excited. And then of course, the obligation created turnover. And so we really sat here and said, how do we slow that down? So I've been with New Health for 15 years. And today we actually have more qualified applicants than we can hire. So I hope you heard me correctly. We have more applicants than we can hire, and they're all qualified. So now we're having to get more creative in utilizing our staff, because we've really become that employer of choice. So from January to June of this year, so we came off COVID, 2021 was that workforce challenge. We launched New Health University in 2021. In 6 months, we've hired 45 new staff members. And we actually have taken away our sign-on bonuses because we have lots of applicants. And so you're probably wondering, how are we doing that? So here's how we're doing it. So in September of 2021, we launched New Health University. And so that program really is a mission of, sorry, Lindsay, can you go to the next slide? The mission of New Health University is to create community-based education pathways for rural youth and to empower employees with training, education, and internal career pathways to strengthen our current and future healthcare workforce. And so this program was a culmination of many years in being creative and trying different things out within our organization. And so you might ask yourself, what is New Health University? So I'm not an accredited university, but I am an internal workforce training program and an umbrella for all of our strategic workforce initiatives, including strategies for pipeline development, recruitment, retention, and employee growth within. So I'm going to let Lindsay tell you what we are not.
So as Desiree mentioned, we're not an accredited institution and we're not trying to be. So this program is really based on our unique workforce needs in our rural service area. We're not currently interested in becoming a teaching health center. We want to partner with the teaching health center in the nearest urban area. So we'll continue to kind of talk a little bit more about what are the needs that we've identified as an organization.
So part of our planning process was really, to make sure that we had a strong and clear organizational vision statement. So we're going to, our vision is to be a trusted local healthcare provider of choice, the best outcome for every patient, every time for generations to come. So then when we aligned New Health University, it's the vision to become the employer of choice for our communities, career training, growth, and academic achievement. And really, those two vision statements are aligned and well supporting each other. So when we go to the next slide, you might say, well, what is New Health University? We see it's got a roof. We've got to see it has a door. But we really put together 4 pillars. And so we're going to look at the bottom of this slide. And it's PATH, P-A-T-H. And so what does PATH mean? Pathways. So that's going to be explained in a few minutes, but you can see the illustrative on the top. So we're going to show all of our staff a pathway for career growth from start to finish. And then we're going to advance. So we've adopted internally a culture of advancement within. Then we're going to empower our employees through training that's very consistent. So I know a lot of people focus on continuing education. This takes it to a whole new level, and it's done throughout as an organizational philosophy. And then higher education, and that's where we really start partnering with our external partners. So I'm going to have Lindsay talk about the pathway that's illustrated above.
So this illustration, we actually first developed this for high school students in our service area. We have received incredible feedback by creating these visual pathways. So this first one that you're seeing is a pathway if somebody were to start in our dental assistant training program. And it's one thing to tell your community or to advertise that you have some type of health professions education training program, whether it's an apprenticeship or other types of on-site training. But it's another thing to actually show somebody this visual and to help them understand not only the training, what's required, the length of time, but then also what are their options within your organization. And so you see somebody can enter our dental assistant training program. That's going to be a 12-month training. Once they've completed that training, they're a dental assistant for New Health. And from there, if they want to continue their training, that could lead to becoming a certified dental assistant. We've also heard great feedback of just having these dollar signs to, in a very simple way, show people that as they continue with our organization, receive training and experience, it gives them the opportunity if they want to pursue other positions within New Health. And so we're really excited to show you guys a couple different examples of these career pathways that we've developed specific to our training programs. And Alex, if you could go ahead and bring up our next poll question. So hopefully you guys are all in Menti, or you're welcome to use the chat here in the webinar. But we want to know what clinical health profession and education training programs does your health center currently offer? So we just shared a career pathway for our dental assistant training program. Maybe you also have a DA training program, or perhaps you have a nurse practitioner residency, maybe other types of student rotations or training programs. So Alex, are there any entries coming in through the box? I don't see the
it may take a moment because it's
okay.
a free response, and I will put the Menti link in the chat again real quick.
Perfect. And I see somebody used the chat here for the webinar. They said they have both dental assistant and medical assistant training programs. And then another great example, somebody's precepting nurse practitioner and PA students working on a PA residency, which is awesome. And please continue to share. Go ahead and continue typing in those responses. And Alex, if you want to go ahead and switch back over to the slides. So these are the 6 goals that New Health developed for New Health University. And during today's webinar, we're really just going to focus on 3 of these goals. And we're going to specifically give you guys some examples of how we're implementing that specifically for health professions, training and education. It is as you've probably already caught on, New Health University is a much, much larger program, but we're just going to try to focus on 3 elements today. So of the goals that we're going to talk about today, it'll be the first one. So to grow and diversify local health professional pathways in rural communities. The third goal, provide regular training opportunities and dedicated time for training. And then the 5th goal, to partner with schools and academic institutions to support current employee education needs and to support healthcare workforce pipeline development. And just to reiterate, as Desiree said earlier, obviously we developed this program for our rural service area, but even if you're not in a rural area, I hope this really inspires you. I tell people, if New Health could do it, anyone can do this. So we really want to share tools and examples with you. So I don't have the ability, oh, here we go. Okay, so while we're primarily going to share with you examples of how we're implementing just a few of those goals, we feel it's really important to share with you what is our concept of a comprehensive workforce development plan. So at New Health, as Desiree mentioned, this is a result of years of testing different things, but really in order to formally launch New Health University last year, the organization had to do an assessment of what were our current workforce needs, as well as the resources that we either had as an organization or identified that we needed to have in order to roll out this program. We got buy-in from our board of directors. We created a mission and vision statement and our 4 pillars and goals. We've incorporated this into our organization's strategic plan. And then what you see here is what I would call what is the full spectrum of workforce development. So I just think it's important to step back and think, if you're developing, let's say, a nurse practitioner residency program, or you want to become a teaching health center, those are all great things if that's what you've identified that your health center and your community need. But just keep in mind that those are just individual strategies or initiatives that you're working on. How does that align with your larger, more comprehensive plan? And so here's our secret sauce. If you were to look at this pie in front of you, right, and just split it right down the middle, the 3 pie slices on the left, so training, internal pipeline development, and then growth and advancement, which includes succession planning. If you focus your efforts and do really, really well on those 3 pieces, you are setting yourself up for success for the other half of the pie. So if you're doing really well with that left side, that is all going to feed into your success of your external pipeline development, your recruitment, and your retention strategies. So here's another example of a career pathway that we've developed. And so this is for our medical assistant apprenticeship program. And we actually have several paid on-the-job training programs at New Health. So we have this medical assistant apprenticeship, we have a pharmacy technician apprenticeship, and we have a dental assistant training program. And I know some of you may already have one or all of those programs, but if you don't, I'm just going to briefly share how did those 3 programs come to be, because there's really some great options out there that you could partner with other resources to bring these programs onto your health center. And again, keep in mind, the reason that New Health has focused on these, this was our biggest need, is really those clinical support roles, as well as entry-level positions, and then even some non-clinical roles such as marketing or IT. So for our medical assistant apprenticeship program, we actually partner with our state primary care associations, the Washington Association of Community Health. They developed the curriculum that is available to any organization statewide who wants to partner with them to host apprentices at our health center. So we're the employer, we have to recruit and employ those medical assistant apprentices, but then our state association has designed that curriculum that we're following for this 1-year training program. So that's a really great partnership. There is a commitment on our organization. We do have staff who are involved in that training, but having our state PCA as a partner really has just made this to be a successful program. For our pharmacy technician apprenticeship, we have a different state partner. So it's actually the Pharmacy Association for Washington State. They have developed a curriculum that you can access, and then you just need to personalize it for your organization. And so again, getting access to somebody else who's already developed that curriculum, just kind of, sorry, I'm hearing a little noise in the background. That's really made that an easy program for our organization to adopt. And then I see somebody asked a question. They said, if the MA apprentice does not pass the certification at the end of the year, are they repurposed to another position within the organization? So they certainly could be, but to be honest, we've not had that challenge. One of the great things about this program, so not only do your apprentices have support through a mentor or coach at your health center, there's also a certified instructor who's handling the online curriculum and skills tests for that program. So it's a very high success rate. And in fact, our State Primary Care Association actually tracks the number of people who enter the program and then who successfully completes. And it's a very high successful completion rate. But if somebody doesn't pass the certification the first time, they can always take it again. And so then the third training program that I wanted to mention is we do have a dental assistant training program. And that is something that we do completely in-house. So we don't have an outside partner. You really need to look at what are your state requirements for certification and licensure. But here in Washington State, dental assistants are not required to be certified. So we have that flexibility to create our own program. And that has worked really well for our organization, is to really embrace that and develop our own training. And so we're able to recruit people for a full-time paid on-the-job training program. So one thing I wanted to point out here in this particular pathway for a medical assistant, so somebody can enter our program. It's going to be a 1-year training program. At the end, they do take certification exam. They'll become a certified medical assistant. We have plenty of medical assistants and dental assistants at our health center who love their profession, they love their career path, and they'll spend 20 years or more as a dental assistant or a medical assistant, and that's great. But we do have opportunities if they do decide to move in a different direction. So, you know, after somebody's been in MA for a while, they might say, hey, I'm really interested in operations. And we have examples at our organization of people who started as an MA and now they're in our operations department. But we also want to create a pathway for somebody who says, you know, I want to be a medical assistant. I don't want to go into operations or IT or anything else. we have the opportunity for them to become a trainer within our organization. And in a few minutes, Desiree is going to share a lot more about our training program. But I did just want to show you in this pathway, when it says medical assistant trainer, there's really two options. Somebody could be working as a full-time medical assistant, but then they've also been identified as a trainer. So they're helping to train those next apprentices who are coming on and are training on site to become a medical assistant. The other option is our health center does have full-time trainers. Desiree will talk about what exactly is that role, but somebody could go from being a medical assistant, taking that valuable clinical experience and background to actually becoming a trainer within our organization. And so next, I wanted, as we're talking about, again, this first goal of New Health University, which is to grow and diversify pathways. So this is an example of one pathway that we've introduced in our community, but what if we could, think outside the box and actually expand that pathway even further? So here you can see we've expanded this pathway down into the high school setting. This is expanding our workforce pipeline. So if any of you are familiar with the medical assistant apprenticeship program, that has to follow, it's a registered apprenticeship program. So it's following regulations from the US Department of Labor. It's a great program. It has certainly helped our organization, but there are a couple of challenges with it. So it is 12 months. Somebody has to work full-time, 40 hours a week in your clinic. Plus, they have to do an additional 10 to 15 hours a week outside of their job where they're just doing online coursework. And that can be challenging for some individuals depending on their life situation. So the other component of it is while somebody is in that apprenticeship program at your health center, they're on a 1-to-1 ratio with a coach or a mentor. So one of your existing medical assistants can only be assisting one apprentice at a time. So you're tying up that coach or instructor role for a full 12 months. So with New Health, we were still having workforce challenges with getting enough people into that medical assistant training program to fulfill our needs. And so we were, a couple of months ago, were awarded from Washington State a grant to develop the state's first medical assistant pre-apprenticeship. This gives us the ability to actually start the apprenticeship program with somebody while they're still in high school, which is really exciting. Our local school districts are really excited about this career training opportunity. So it's the same curriculum as the registered apprenticeship. It's just that somebody is able to start working on those hours while they're still in high school. So by the time they graduate, they aren't going to have to do a full 12-month apprenticeship. That timeline is going to be shortened. It also removes that requirement while somebody's in high school that they don't have to be at that 1-to-1 ratio. So just as an example, if you had one medical assistant who's an instructor, maybe they're overseeing 2 apprentices in high school, and those apprentices might be coming on different days of the week, right? They're not working full time. They might be just coming, 10 to 20 hours a week to get their on-the-job training. So we're really excited about this one way that we're growing and diversifying a pathway in our rural community. And Alex, if you could bring up our next poll question. So does your health center have designated training staff? And whether that's a full-time role or a part-time role, do you have people who are designated as trainers at your organization? So we've got some yeses and some nos. Looks like more nos than yeses. Oh, now we're about 50-50. So Alex, if you can bring back our slides and take it back to the first training slide.
So when we talk about trainers, and this is goal number 3, And so this is very much an internal component and recognition for your staff. So I would encourage you, get out, really spend time and start noticing who people are reaching to. And so we don't have multiple trainers. We have a 3.0 FTE staffed for New Health University. And this kind of comes into the question earlier about what happens if someone doesn't pass the test. So we identify our trainers and then we support those that are in the training program. And so we do a lot of work investing in their onboarding, orientation, and skills checklists. And so we have a manager and then 2 trainers that are doing the majority of that orientation checklists and the 90 days and annual skill checklist. And so you might ask yourself, well, how did you post for that position? How did you hire for that position? We'll show you in a minute who my manager is. It's someone who's been with me 22 years. And so they've really shown that they are a natural trainer within the organization. And so we want to really identify people who understand the platforms, understand the profession, kind of have got their skills up to a high level. And so like Lindsay said, sometimes people want to be an MA or a DA for 20, 25 years. But people love to share, especially in community health centers. We're givers, right? And so to give that knowledge to the new generation of medical assistants, dental assistants, RPAs, nurse practitioners. I know some people in the chat earlier said, will we take students? So you already have started a culture of a training culture. It's just New Health University takes it to the next level. So really identifying individuals that are showing leadership skills in training really helps you identify who could be a trainer. And then we do skills checklists. And so our trainers go out with everyone who's hired and they look at what is their skills, it's more of a coaching report. And so we really talk about in our organization, coaching from the positive, right? Because everyone can tell you what you do wrong, but here's how the things you do really well. Here's the areas that you need to improve on. And so that's some of the things the 3.0 FTE New Health University trainers do through the month. And so we have about 150 employees. And so they're training with those new hires. And so then we also there's only 3 of them. And so when we have 45 new hires in a 30-day period, you might ask us, well, how do you get everybody trained? So we designate our front desk trainers, our medical assistant trainers, and it's a 1-to-1 ratio. Well, how do you get an MA staff to say, okay, I really am already tapped out and now you want me to train? And so again, it's that continuous internal culture that you're changing. And so we do offer a shift differential for our employees. If they take on a student, they do get $1 an hour shift differential during that trainee's time. And so we do that with medical assistants and dental assistants. And so we also offer each one of them New Health University training. And so we recognize them at our monthly site visits for anyone who's been a trainer. And so these have been really well received, these changes to get people involved in the training. And so I just think it's really positive. So when you talk about, who's our trainers? So we're going to meet one of our trainers. She is our New Health University manager. So Lindsay or Alex, can you switch to our next slide?
Yeah, I don't have the control, Alex, if you can switch slides.
So I'm going to introduce you to Melissa Russell. She's actually a certified medical assistant. She worked for one of our busiest clinicians. And so I just really love her quote. And so I'll give you a few minutes to read that, but really pointing out someone who's been here 22 years. And so when you kind of think 22 years, that seems like a straight line pathway in someone's career. But if you look to the boxes to the right, Melissa was hired as a supplemental medical assistant. Shortly thereafter, she came on as a full-time medical assistant and did that for, I'm going to say, about 10 years. Our organization changed. We went from paper to EHR. She really illustrated that she had strong skills in explaining processes and challenges and helping when she could identify when someone was struggling. And so she would go to that person and say, hey, how can I help you? She stayed after hours. And so she really did a great job on the computers. So great that she kind of took some time off from the clinical operations and went into our IT department as an application specialist and really had a great understanding of the pathway of the computers and how to navigate them. So when we launched New Health University and she applied, for us in leadership, it was a natural transition for her to take over that because she really understood what it was like to come on as a new hire and work in the ranks next to her peers in her health education careers. And then understanding the external components of that computer, because many of my clinicians were, they were on a SOAP note. And so for them to have an EHR template, she really broke that down very easily for them. So she spends her entire month developing programs, developing training, and monitoring her 2 trainers. And her 2 trainers are deeper in the weeds of training that front desk medical and dental, and they really focus on that. So when we talk about training, each month New Health sets aside 2 hours. And so you might ask yourself, well, what do you guys train on? So again, we're training 150 employees. And so this is an illustration of what our training time looks like. She vets all the training materials. So you see those on the right-hand side. She assigns them to each department and provider team. And we've kind of gone through and looked at, like you would a student curriculum. So February is American Heart Month. And so really she gets this training for medical providers, dental clinicians, medical assistants. And so it's really a theme and making sure that the whole care team is trained in an effective manner. But, like I said, this is just a really snapshot of what we do during that dedicated training time. And everybody in the organization is given this. And so I think we're kind of ready for, training. Do we have another poll, Lindsay? It looks like maybe.
Yes, Alex, if you could bring up our next poll. We're curious. So we've kind of shared with you, what does training look like at New Health? So we've dedicated monthly time, as well as Melissa's team is going out throughout the month to identify training needs of our existing staff. And then we have a structured training program for our new hires who are coming on. So how often does your health center set aside dedicated training time for staff? Is that something that you're just doing during onboarding? Do you have monthly time carved out? Is it annual or another frequency? Or even not defined, right? You might just say, yes, here's required training, but maybe it's just kind of up to your staff to find free time throughout the month or the year to complete the required training. So it's interesting to see, we've got all the colors on the board right now. And I'm sure this is different for each health center. And maybe this is something at the end during Q&A, we'd be happy to discuss further about how have we developed this. But we really spend the most time, when we talk about all of our New Health University goals, we spend the most time talking about training because that's such a high priority for our organization. We really dedicate a lot of time and resources to developing that program.
So I think one of the things too is just this, our clinicians get carved out CE time in exclusive, so that's in addition to this. So just I would imagine most of you have CE time for your clinicians, but this doesn't go towards their CE. That's above the training that we do.
So if we can go back to our slides.
Perfect.
You can advance it to the next cell. Here we go. I can advance it. Okay, so we're just going to spend a couple of minutes talking about this 5th goal, the partnership goal. And there's really an internal and an external component to this. So internally, we have a commitment at New Health to help our employees to grow and advance within the organization. We'll identify, is there an employee that maybe in order to advance, maybe they need to get their bachelor's degree. And so we'll actually provide them with tuition assistance And part of what Desiree spends her time on is talking to academic institutions who might provide a degree program that would be of interest to our employees so that we can actually help connect those employees. If somebody's never gone to college before, they might not understand what is that process. And so that's part of our partnership goal, right? Is helping our existing employees if they might need access to an outside academic resource. But the other component to this is really external, right? So going back to that external pipeline development, as many of you probably already do, we also have student rotations, right? So we have medical students, nurse practitioner students, dental, PA, all these different students for years and years have been rotating at New Health. But when we really launched New Health University and helped to define our workforce development program and what did that mean for our organization, right? So creating that mission, vision, those structured goals, it really gave us the opportunity to go back and work with our academic partners in a new way. And so honestly, we're really challenging those partners to say, are you developing the type of training program that we need for our clinicians in our rural service area? And so one of the good things I would say that came out of COVID is a lot of schools, if they didn't have online courses before or some type of online component, they now do. And so really challenging them to how are they creating training opportunities in our rural communities. It's not enough to just say, oh, I want to train nurses to work in rural America, but are you actually making it so somebody doesn't have to leave our service area to get that training? And so one example I wanted to share with you guys of a success story that we had recently was we challenged one of our universities who's developing a new RN program, and they received funding from the state to develop this rural nurse track, right? But they were going to train the nurses at their college campus, which is in an urban area. And so we challenged them in two ways. We said, you know, the ideal would be if you actually, you know, create that campus in our rural service area. How can you actually make it so somebody doesn't have to move to the city, but they could stay up in Colville, Washington, which is closer to the Canadian border, and be training as an RN up there. So that was one request. But the other request was actually some low-hanging fruit, I would say, is we asked them, if you look at your curriculum to become an RN, how much of that is required in-person hands-on labs versus, you know, is maybe an online course? And could you try to group all of those online lab days on one day of the week instead of spreading them across the week? Because if a commute is, you know, an hour and a half or even 2 hours from a rural community into the city, well, that might be realistic if you only had to do it one day a week for 2 years while you're pursuing your nursing degree. And so they actually went back and looked at their curriculum, and lo and behold, they had spread those lab days throughout the entire week. And they had never thought about just trying to group them on one day before. And so they came back to us and said, yeah, we think we could do that. That was a huge win for us. It's super exciting to be able to work with an academic partner who is open to those ideas and gets it, understands why would we make a request like that. So I really encourage you to challenge those academic institutions. And Desiree can share more about, you know, what are these requests that we're trying to make right now?
So I think the biggest thing is, Lindsay's right. We challenge them every time to rethink outside of academia and really asking them, you know, are you fulfilling the needs of the partners that you have where you're producing students for? And so, you know, we've challenged the dental hygiene programs in our area, because I'm sure, just like us, many of you are facing dental hygiene challenges. How do we get more of those into our health centers, and how do we partner and make it more realistic? How do we get some of our adjunct faculty with our own staff? I mean, our dentists, our MDs, you know, we do dental student rotations, but how do we take that to the next level? And so we work with the University of Washington. And so today we're at capacity for our dental students and our dentists. And so we actually are turning some away, which again is a positive thing, because our tracks are working. And so don't be afraid to challenge these institutions. And also, we do a very formalized process. They apply through our regular system as they were a normal employee. And New Health University really focuses on that partnership, helping support them, getting to know them, finding out what their career goals are. So when we have a student that comes in from any discipline, they come into our HR system, they really become familiar with us, and we help mentor them through that. But I think the biggest thing for you guys to do is challenge your academia to make sure that they're aligned with what your needs as an employer are, and to rethink their model. Because again, like Lindsay said, COVID gave us an opportunity to change the way we deliver our education system. So I think we're ready to go to the next slide, because I know we're coming close to time and we want to leave ample time for our conversation and question and answer. So Lindsay kind of mentioned a little bit, we have a new campus partnership with one of our local high school districts, and we are looking at the career pathways for high school students. The other thing we're doing is called Connected Careers. And you might say, what is that? And I think we can think back a couple of years ago when all the physicians, our baby boomers were retiring at a historical rate. Look at all the knowledge that, transitioned. And so we're going to take that knowledge and transition it from experienced professionals, passing that knowledge on to future generations. And so I'm going to kind of let Lindsay talk about the third bullet, and then we'll be ready to go on to our next slide.
So some of you may have seen at the beginning of the year, NAC put out a Workforce of the Future challenge. And so we submitted some information about New Health University with a focus on some of the components that we didn't really target too much during today's webinar, but really what we're doing with high school youth and our youth outreach and workforce programs. And New Health University was selected as one of NAC's top 5 finalists. So this summer, you're going to see NAC put out a how-to guide with examples from health centers across the country. And we're really excited to be a part of that publication that is coming out. So I just wanted to give you guys a heads up to keep an eye for that this summer.
Yeah, so this will bring us to pretty much getting to the close of this. And so I just want you to go back to our logo. It's a house with opening doors. That was really important for us. You want to send that messaging. And I think too, when we go to the next slide, each employee, it's their path, their journey, their career. Empower your staff. It doesn't matter what discipline, what department. And we're just excited about New Health University and all the changes it's brought forward for our organization. And we can't wait to share with everyone. And we are so excited you attended our session today. And so I think we're ready to go to the final slide and then some Q&A.
And I do see a question in the chat asking if we have educational material translated into Spanish. We do not at this time, but that's certainly something we could do. Something we do have developed as far as like written materials for New Health University. We mentioned we have such a strong focus on our internal training program for our staff. So Melissa and her team, they have developed these great tools that are the onboarding program, the skills checklist, 90 days checklist, that annual checklist, and then how are they going in and analyzing workflows and creating coaching reports. So as far as materials, if the health center was interested, that is something that we have available, and we could certainly look at getting that translated into Spanish. So thank you for that question.
Yeah, that's a great question. Gigi, thank you for the feedback. That's positive. We appreciate that. So I think have fun with this. It was a really great program for us as we developed it. Empower your staff. It really does breed a culture of enthusiasm and excitement. Employees today want to be a part of something. They want to feel empowered and they want to feel heard. And so realistically, let them be heard and, help them be part of that solution. So
thank you both.
Alex,
so
I don't
much.
know if you have other questions or wrap up.
No, we can wait a couple more minutes, and if anyone has any other questions, And regarding the translation one, I sent a message to Michelle, who does work on getting some of our stuff translated. And I don't think we have a whole lot related to HPET yet, but the Puerto Rico PCA who sent that message, they have translated some stuff in the past. I know we're continuing to work on translating more of our material, so hopefully we'll have a little bit more stuff that's accessible in Spanish. And before
Something
folks, oh, sorry.
If I could just add on to that, something that we really encourage other health centers to do is that career pathway visual. That's something that any health center could create, right? Because it might look a little bit different from organization to organization. So, you know, think of whether you have somebody who has some great design skills, or, you know, if you want to hire that out, anyone can create those career pathways. And so I think that's just something you could really personalize and put your own mark on that for your organization. Because again, we're seeing huge success in our local service area with sharing those visuals with our high schools.
And I think to go along with that, Lindsay and Alex and everyone in participation, so when we really sat down and launched the mission, vision, goals, pillars, logo, everything, and our plan, that really got bought in from the board of directors. And so they could really see that strong plan. And as we've rolled this out to our community stakeholders, you know, I mean, it looks like we, you know, presented it in September and we've got these results. It really did take us a little bit of time to get this and move through the program. But that strong groundwork has really been beneficial as we've gone out and talked to the community, and they can see the community benefit. And so it's not just healthcare, it's also other industries that are facing workforce challenges. So, you know, we have a lot of our external partners that are asking to bring staff in to our university. And so we really did have to put the word internal workforce development, because when you really invest in your team and your employees, it just helps you fulfill your mission. And that's truly what we're here to do, is improve the patient experience and fulfill the mission of your organization. So that groundwork will pay dividends when you're trying to have the conversation with your leadership teams, your board of directors, and your community stakeholders. So we're excited about New Health University. We love it. Everyone at New Health will talk to you about it if they're a new hire, or they're the manager or executive leadership team or your board. So we just really appreciate everyone's time. We know you're busy. And so we're excited to share with you. And I think there's more opportunities for workforce development in the future for all of us.
Absolutely. Wow, thank you so much. That was absolutely fantastic. And yeah, let's for anyone that's interested in more, obviously New Health, they have tons of great information. And then also at the STAR Center, we have our resources on our website that are available for folks as well. And then we have some self-paced courses to kind of get you started, not quite as in-depth as some of the things New Health has created through New Health University. But if you're just looking for kind of the starting points, we have some great online courses. And as Michelle pointed out, some of those are also in Spanish. And then you can always reach out to us at info@clinicians.org or give us a phone call. And I believe that is it. Well, thank you again, Lindsay and Desiree. That was really fantastic.
Thank you for the opportunity, and thanks to everyone who participated, made comments. We're excited to share, and then always to hear what our other health centers doing. How are you taking this knowledge and implementing it in your local area?
Yeah, thank you. We appreciate the opportunity to spend some time with all of you today, and so we appreciate all of it.
All right. Yes, and thank you everyone that attended. Hope everyone has an excellent week.